So today we have a Michigan COVID response data and modeling update with Dr. Line Callow from the Michigan Department of Health and Human Services. We will have some brief opportunity at the end for some question and answer, but I'll let you know when that occurs. At this time, make sure everybody's on mute. I would appreciate that so that Dr. Line Callow can be heard. And with that, I will turn it over to Sarah with one last note. If I did not give you permission to record, please raise your hand and I will do so while we get started here. Dr. Line Callow, take it away.
Good morning, everyone. Thank you for the opportunity to share some information with you. Moving to the next slide. Today, you're going to hear that Michigan is in high level of community transmission. Our positivity, case rates, inpatient bed use, and mortality metrics are all increasing. And the Delta variant of concern is now the predominant variant in the state of Michigan. Our testing rate is holding steady, and the number of people who are vaccinated is slowly increasing. We're also going to share today some models that we have that are projecting continued increases for 4 to 6 weeks or perhaps longer in cases and hospitalizations. The large majority of cases, hospitalizations, and deaths are occurring among those individuals who are not yet fully vaccinated. And we are also going to just touch on layered mitigation is still needed to limited surge cases and to reduce any missing of class time. Next slide, please. Right. So globally, COVID-19 continues to climb in cases and deaths. The US is one of the countries with the highest case counts in the world. Nearly all of the US is at a high level of community transmission, including now the state of Michigan. Next slide. I want to thank University of Michigan Madison for pulling case rate, percent positivity, mobility statistics, and hospitalization rates for states that had Delta surges earlier on than Michigan is experiencing. You can see that case rates, hospitalization rates for some of these communities or jurisdictions rather are the highest that they've ever had during the pandemic. So the next slide is comparing Florida's rates to Michigan. Our hospitalization rate is still 10 times lower than that in Florida, but our positivity is starting to creep up and our case rate is starting to climb, although it doesn't look like Florida at this time in any way. And then the last slide of this series, Nevada, you can see has not been as strongly impacted for hospitalization as Florida or Louisiana, but does have positivity over 15%. Louisiana is currently experiencing 1,000 cases per million people per day and 625 hospitalizations per million people. So next slide, we start digging into Michigan more. We can see that COVID-19 is beginning to increase in terms of cases and positivity and Delta is a large part for why this increase is happening. Positivity is now at 7.7%, with some areas of the state at or near 10%. Cases, we're now over 100 cases per million people, which is 600% more than we were when we were at our June 26th low. More than half of the counties in the state are at high transmission level, and most others are at substantial. And just a reminder, this is where CDC recommends mask wearing by all individuals, regardless of vaccination status, when in indoor public spaces. And we are starting to see outbreaks tick up again. The next slide, we have added our CDC transmission thresholds to what we refer to as our postage stamp. The CDC thresholds are based on case rates by report date. So when did the state health department become aware of a case? The rest of the case information that's in purple is based on onset date. So when did someone start to feel symptomatic, or if we don't know when their symptoms started, when did they test positive? There are 2 areas of the state, Grand Rapids and Traverse City, that are still at the substantial community transmission level. All other regions are at high, as is the state as a whole. All but 1 regions in the state have almost 100 cases. They're all over 97 cases per million, with most of the state continuing to grow. Positivity is also increasing in most areas of the state. You can see we're at 7.7% for the state as a whole. Note that we're over 10% in Kalamazoo, which is also, that MERC region is experiencing one of the highest percentages of inpatient bed utilization. Inpatient bed utilization has been increasing over the past month. We're now at 4% of beds being used to treat, inpatient beds being used to treat COVID-19 patients. And we are starting to see an increase. I mean, our mortality rate is still at 0.6 deaths per million people, but we have seen an increase for a couple of weeks now. The next slide gives us a look at these metrics for individuals under 12 years of age. Given that children at this age cannot be vaccinated at this time, we wanted to look at their data separately. A couple of things to flag in this table. Kalamazoo region, these are Merck regions, have the highest case rates for children, followed by Saginaw and Lansing regions. Hospitalization rates for children this age are highest in the Lansing Merck region, followed by Grand Rapids and Detroit regions. The next slide, just wanted to highlight that the My Start Map website now includes CDC transmission levels. Those are available for the state, at Merck region, and at the county level. This dashboard will have the most recent data available and will be updated in a more timely manner than the CDC website is. We can see on the graphic on the left that there was a rapid increase from our June low to over 100 cases per 100,000 people reported each day over the last few days. You can also see on the county map on the right where the dark red and orange, that is substantial and high levels of community transmission for the majority of counties in the state. The next slide is giving you that same look at the data, but using onset date. So even if we look at symptom onset, we're still showing a similar increase in geographic pattern and trends over time. All right, next slide moves us into looking at our case trends by age groups. All age groups are seeing an increase in case rates currently. Rates are highest in those 20 to 29 years of age, followed by groups that are 30 to 49 range, and then 10 to 19-year-olds. Next slide, please. This slide gives you the most recent data out of that graphic and the change from the last week for each of those age groups for some specifics. And the next slide, we look at our case rates by race and ethnicity. With the increase in cases, we're seeing a shift in the rates by race and ethnicity. White individuals now have the highest case rates, as do Hispanics compared to non-Hispanics. Rates for white individuals being higher than those for African American, Black individuals just occurred around the end of July. Prior to that, we've been seeing a reverse in that disparity during the end of the last surge. The next slide gives us a picture of Delta variant. So, well, all variants of concern in the state. So the map on the right is giving you, the darker color tells you that there are a larger number of types of variants of concern being found in those counties. We are now seeing variants of concern in at least 81 counties in the state. I expect that these variants are spreading other places as well. For Delta or B1617.2, we now have 58 counties where at least one individual has been identified as having Delta variant. It's making up 99% of the samples that we had available for sequencing in the last 4 weeks. And the next slide, the local health departments are very busy now addressing outbreak investigations. We now have 183 outbreaks investigations going on. This is a third more than last week, and we have 86 new outbreaks in the last week. The most frequent site type is the very large group of organizations that fall under manufacturing and construction industries. But this is the first time that they've been at the top of the number of outbreaks for a while. Social gatherings continue to produce outbreaks, some of which are very large. We've identified 14 new outbreaks in the last week for childcare and youth programs. And we have 13 new outbreaks identified in long-term care settings, and that does, in this case, include assisted living facilities. Looking at other data that we have available, we know that long-term care outbreaks are tending to occur in settings where vaccinations levels in staff are lower. Next slide is giving you some information about indicators of severity and the impact on the healthcare system. Hospitalizations and ICU utilization are increasing. And we're going to go through some detail about that in a minute. Deaths have also been increasing for the past 2 weeks. Next slide gives us a look at the trends of ED, emergency department utilization for COVID-like illness or diagnosed COVID. You can see that we've increased to 2.1% of ED visits have a diagnosis of COVID-19 with them. Trends are increasing in all age groups. The largest increase is being seen in those 40 to 49 years of age. Hospital admissions on the next slide are also increasing in all groups under the age of 80. Individuals who are 60 to 69 have the largest number of admissions in the state. The next slide is giving us a look at the total COVID census in the inpatient. The COVID census in the hospitals has increased 23% to 823 inpatient beds being used for COVID, but the rate of growth in hospitalizations has slowed from what it was last week. Next slide gives you that information by region. Region 2 North and 2 South, basically the Detroit metro area, have the largest number of hospitalizations, but the fastest growth in hospitalizations is occurring in regions 3, 6, and 8. All regions except the UP, region 8, are over 50 hospitalizations per million people in those regions. The next slide gives you that same information for COVID-19 status in the ICU. ICU utilization has increased 15% to 195 beds being used to treat COVID-19. 6 regions have increasing census this week, with region 1 and region 6 having 10% or more of their ICU beds occupied with COVID-positive patients. Next slide moves us into looking at mortality. Our daily average deaths have been increasing just in the last couple of weeks. And you can see the 7th-day average death rate is still below 1 death per million people for those under the age of 70. Next slide gives us death rates among by race and ethnicity. Death rates are highest among those who are American Indian, Alaska Native. Next slide, please. COVID-19 vaccination. This week, there were almost 4,000 first doses administered each day to Michiganders. Those doses are administered most frequently by pharmacies, followed by local health departments and hospitals. We now have 4.96 million people who have completed their vaccination series. The next slide gives you a little bit more detail about that. For the week ending 8/14, and we pull the data on 8/16, we've had more than 44,000 doses administered to Michigan residents. The graphic on the right is showing the daily change in the number of first doses administered. When the blue line is over the red dotted line, that's telling you that the number of first doses administered is increasing. So this graphic shows increases in vaccine first dose uptake after the announcement about 12 to 15-year-olds being eligible for vaccination, after the lottery announcement in June, and then recently we saw an 18-day sustained increase in first doses, which is very encouraging to see that continue to increase happening there. Next slide, please. So it's just giving you coverage numbers for different age groups. We have more than 4.9 million people who are fully vaccinated in the state. 82% of older adults have completed their vaccination. We continue to see racial disparity in vaccine coverage, with rates being lower among those individuals of Black or African American race based on the data that are available to us. We do have 20% of our data missing, race and ethnicity. Our next slide, we continue to monitor the number of cases of COVID-19 that occurred among people who were fully vaccinated at the time they became ill. We've identified 12,121 cases that meet this criteria since January 1st. This is less than 1% of all people who are fully vaccinated in the state. So let's move into Science Roundup in the time we have left. This week in Science Roundup, on the next slide, you can see that we're answering a couple of questions here with the slides that we have available. We want to illustrate what Delta is, that we expect it to cause a surge in cases and hospitalizations in Michigan based on current situation, and that we expect that will increase events among children. We also provide some information about how vaccines are working, and we know that they continue to be effective at preventing hospitalization. We have We need to continue to get vaccinated and make use of masking and other mitigation strategies that prevented transmission in the past. These will work against Delta as well. But we also have an exciting new tool, a new use of Regeneron in people who have been exposed to COVID-19. If they meet certain medical criteria, and use that drug, which will help to reduce the severity of their COVID-19 infection if they do become sick with COVID-19. So Delta is more transmissible than Alpha was, so it's even more important that we make use of these mitigation measures. So let's move on and talk about what Delta variant may mean for Michigan. And I want to thank the University of Michigan School of Public Health and Michigan medicine researchers for sharing their expertise and the contributions to Science Roundup here. So the Delta variant is twice as transmissible as the Alpha variant, that B.1.1.7 that hit us so hard this spring. This slide is giving you the case rates and how those changed in states that were hit by Delta early on. These 5 states that we've selected here in this graphic are the ones that were impacted earlier during this Delta surge in the nation. We've also included Michigan as a comparator there. You can see that more recently we're starting to see an increase in our case rates. A majority of these states are about a month ahead of Michigan in terms of their Delta variant levels, and when we saw their case rates begin to rise. And all of these states are 2 or more weeks ahead of Michigan. So it's important to look at these states and see what their experiences have been. We have been running some what-if scenarios. So for hospitalization, if this wave that we appear to be entering continues to grow and follows the growth patterns of prior Michigan waves, so the winter wave or the spring wave, what might we look like in terms of hospitalizations? So we estimate that based on the pattern we're seeing thus far, we will see hospitalizations growing through September with a peak in late September or early October. The next slide are some modeling that University of Michigan School of Public Health has accomplished for us. They are assuming here that our vaccination rates stay sort of at the level that they are and that social contacts continue to increase and that Delta is our predominant variant. The median model projections indicate that this fall will look a lot like last spring, with more than 4,000 deaths potentially occurring during the fall and winter. We can blunt that curve, according to this model, if we are able to increase vaccination rates to where we were in April, or if we're able to reduce the exposures that we have in contacts with each other. And then the next slide is giving you what this model predicts in terms of hospitalizations in the fall. If the age groups that are impacted are similar to those that we saw in March through May. So you're seeing that we could have 12,000 or more hospitalizations between August and November based on the modeling that we're seeing right now. All right, so what does Delta mean in terms of children? Delta will increase the transmission of the virus between children. And we know that SARS-CoV-2 can negatively impact children both directly and indirectly. Children can be infected with COVID-19. The proportion of children the proportion of all cases that are made up of children has been increasing in the last month compared to our cumulative pattern. Children can also be sources of outbreaks, and this was true even before the Delta variant. So looking at the next slide, although children do have, most children tend to have mild infections compared to adults, being sick with COVID-19 can take individuals out of the classroom. And if there's spread within the classroom, it can result in others missing school time as well. And we know that minority and low-income children have been disproportionately impacted by issues with access to in-person instruction over the last year. Furthermore, children, particularly minority children, can experience severe outcomes of COVID-19. A JAMA study reported that 316 persons per million infected people people under 21 years of age had MISC. So we're going to go through that a little bit more in a second. All right, the next slide. Although the US has already had the highest COVID admissions for children of the entire pandemic, that is what that graphic on the left is showing you. I think it's important to understand that almost half of those children that were admitted in the nation had no underlying medical condition. The next slide is, again mentioned, looking at states that had entered had gotten hit with Delta earlier than we have. multiple states, and here Florida and Texas are depicted, are having extremely rapid surges in pediatric hospitalizations. And we could have a similar experience here if we do not make use of mitigation measures. And the next slide just gives a few examples of the kinds of media reports that came out over the last week or two, explaining the difficult situation that some states are in for accessing hospital beds due to the surge. The next slide is talking again about this multi-system inflammatory syndrome in children. So as community transmission increases and the number of cases increase in the nation or in a particular state, we see, after a little bit of a lag, we see a higher incidence of these MIS-C cases. And these are very severe events. Even though they are rare, they are severe for the individuals that are impacted by them. And you can see that, it always takes us a little bit longer to identify the MIS-C cases. It takes some time to identify these cases and to ensure that they do meet the case definition. So I would expect to see that blue line is going to start increasing shortly. The next slide gives you some of the information that we put up on our website for Michigan. We have more than 70% of MIS-C cases do end up in the ICU. So as COVID-19 cases increase, we will later see an increase in the use of ICU for MIS-C in addition to its use for treatment for COVID-19 and other conditions. In Michigan, Black and African American children make up the largest proportion of MIS-C, and therefore any increase will create an unequal burden of this serious consequence for these children. So please remember, the majority of children that are impacted by MIS-C cannot get vaccinated and will be entering school buildings in large numbers in the fall. Next slide is just going through a little bit more of the research that's out there showing that children can also experience long COVID. So about 1 in 20 kids have symptoms for up to a month after they've, quote, recovered from their active infection. And children can also be impacted by increases in case rates as they lose loved ones or caregivers due to COVID-19. In more than 136,000 children who lost someone in their daily caregiver structure due to COVID-19 last year. All right, so let's talk about whether or not vaccines are working. If we go to the first data slide there, we can see that many states have been releasing information on the percentage of people who were unvaccinated among those who were cases, hospitalizations, or deaths from COVID-19. This table provides that information for Michigan between January 15th and July 28th. These numbers are based on Michigan Disease Surveillance System. The vast majority of cases, hospitalizations, and deaths occur to people who have not been fully vaccinated. And again, less than 1% of people who are fully vaccinated get infected with COVID-19. Another way of looking at that is to explore the rates of cases and deaths in the next slide of during surges. So case rates and mortality rates are much higher among people who are unvaccinated than those who are vaccinated during times of surge. Next slide, we do have some high quality data from the COVIDNet, which is a series of 13 states. It's a sentinel system for understanding how COVID is impacting the nation. And it also allows us to calculate formal vaccine effectiveness estimates. So we see that Pfizer and Moderna are 91 to 96% effective at preventing hospitalizations among the elderly. The next slide. I know it can be a very confusing message to say that vaccines are working when people can see that friends or family members who have been vaccinated have gotten sick. This graphic is meant to explain how, as more people get vaccinated, more people who are vaccinated may become cases. However, there are fewer cases overall. All right, also wanted to highlight in the next slide this article that came out. I know that we're getting questions about why you would need to get vaccinated if you've already been infected with COVID-19. Based on laboratory evidence, antibodies from COVID-19 vaccine response are expected to be stronger from those with natural infection. This study out of Kentucky shows that in a real-life context. Among those individuals who were infected with COVID-19 in 2020, people who were unvaccinated had twice the odds of getting reinfected with COVID-19 than those who had been vaccinated. So if you had COVID-19, you can be even more strongly protected against future infection if you get vaccinated. So next slide, we also get asked about, given the spring surge, could it be that between that and vaccination, we have enough natural immunity to avoid a surge here in the state? So we've estimated, or University of Michigan has helped us estimate, that about 63% of people have been previously infected or have been vaccinated. And that sounds pretty good, but let's just compare that with Puerto Rico's experience. So 75% of people in Puerto Rico have either been vaccinated or have been previously infected based on their seroprevalence information. However, Puerto Rico did see a very rapid surge with a peak similar to what they experienced in the spring, and they've reached CDC's high transmission levels. So mitigation will still be important. So I've painted a fairly grim picture here. Let's jump to a little bit about what we can do in response to this. So jumping to the Swiss cheese slide here, we do know what we can do because we've been doing it. This graphic gets at the different layers of defenses that we have against COVID-19 in a school context. I wanted to highlight this one because, of course, children cannot be vaccinated and they're going to be spending hours together in classrooms. Vaccination is, of course, important. However, the correct use of a well-fitting mask, thinking K995s, can be helpful. Making use of physical distancing, use of testing and screening, and staying home when sick continue to be important in our fight against COVID. We know these methods work. We go to the next slide. There are examples of where prevention strategy have protected schools even in a high community transmission levels. And we've also given you a couple of examples where outbreaks have occurred where there was failure in mitigation. The next slide, we have some new data. We know that masks in school settings work. We wanted to model what does this mean in a Delta setting. So what this is telling you is if there's one infectious child in a class of 25 students, how long does it take for there to be a 50% chance of another student becoming infected? So if you don't wear masks, that's a couple of hours at the elementary or high school level. Even with imperfect masking, that time before you get to a 50% chance of transmission increases to a full day. And with complete well-fitting masking, you greatly reduce the chance of transmission. The next slide is another way to look at this. This is a modeling study that researchers in North Carolina did. Without masks, they are estimating up to 90% of children will become infected during the semester. Masking reduces the chance of being infected in schools by 40 to 75% in these models. All right, we have a very preliminary analysis we wanted to share. This is very, very crude, but we did notice that there are some places that have been experiencing Delta surges where some counties had put in mask mandates. This graphic is comparing those counties with other counties of similar sizes in other states where there were no mandates for masking. While other factors could have also contributed, jurisdictions with mask mandates tended to experience lower spread of COVID-19 during their Delta surge thus far. All right, then I know we're running out of time here, but just wanted to share that we do have this new tool, which is very exciting. It's important that we continue to participate in case investigation and contact tracing. Because, not only do you get linkage to services and things like that and be aware that you were exposed in case you need to change your behavior. However, also it's really important that you understand that one of your contacts may be someone, if you are a case, one of your contacts may be somebody who could take advantage of this new therapy. So if someone is at high risk of progression to severe COVID-19 symptoms and they are not yet fully vaccinated, but they've been exposed to somebody who's infected with COVID-19, or they're part of an outbreak in an institutional setting, they can potentially make use of this therapy that will reduce the chance of them having to be hospitalized or dying from COVID-19. So exciting new tool, want to make sure that we're able to use it rapidly. So I just want to close with the last slide. CDC did put out some guidance for implementing COVID-19 prevention strategies in the context of varying community transmission levels. But I just want to make clear, they continue to urge use of masks and maximizing ventilation, physical distancing, staying home when sick. Of course, vaccination continues to be the most effective way that we have to get out of COVID-19 as an epidemic activity. Our strategies should be applied and strengthened as our transmission levels get higher. We know what to do to help protect our children and those most vulnerable so that we can have the best school year possible and we can reduce the burden of COVID-19 on our healthcare system. Thank you.
Thank you very much, Dr. Lancello. All right, we are going to have a brief time here for some questions and answers. Please use the raise your hand function and I will call on you, and then you may unmute yourself and ask your question. If you don't get to you, we will do some follow-up afterwards. Feel free to send me an email, not a problem. I will definitely work to get your questions answered. So we are going to start with Craig Mauger. Feel free to unmute yourself and ask your question. Please try to limit it to one question so we can get others a chance.
Thanks. Thanks for taking my question. My question is, Sarah, have you recommended to the governor that she institute a statewide requirement that students wear masks at school? And if you haven't, can you explain why and why not, I guess? Thank you.
I don't know if that would really be a question for Dr. Line-Callow to answer. So I think we're going to have to probably get back to you on that, Craig.
She can't answer that question?
That would not necessarily be in her purview. Mike Wilkinson, I'm going to move on to you. If you could ask your question.
Hi, thank you. I do think that would be within her purview because she would be an advisor. But anyhow, my question is about last week there were reported 10,000 breakthrough cases. This week it's 12,000, so it's a 2,000 difference. There have been 8,000 cases in the past week, so that's about 1 in 4. That seems to suggest that there's, as we go on with Delta, that there's more breakthrough cases than the smaller percentages. I wondered if we have an idea now on a more recent basis what that is. And related, hospitalizations always seem to use the most recent fully vaccinated, but all vaccinations, all breakthrough hospitalizations going back to January. I wonder if we have a more recent experience, like in the past month, what percentage of hospitalizations are breakthroughs? But that's I guess it's 2 questions.
Sure. So I don't have those numbers for you right here off the top of my head, but I take your questions very seriously and we will work that into our next deck. Thank you.
I'll get that information back to you, Mike. Kyle Mitchell, if you want to ask your question and unmute yourself and ask your question. Thank you.
Thank you very much. Kyle Mitchell with Wood TV. My question is, with the president expected to announce booster recommendations at some point in the near future, does the state have ample supply of vaccines to accommodate any anticipated needs for those boosters?
Hi, this is Dr. Khaldun. I can take that. We are certainly watching very closely what the FDA and the CDC are saying. We are prepared and currently have ample supply of vaccines to be able to supply a 3rd dose if people need it, both for the immunocompromised that was just announced this past Friday, but also if the general public needs a 3rd booster dose, which I believe the CDC has said will begin September 20th. So we are prepared.
Thank you. Deanna, if you'd like to unmute yourself and ask your question. Deanna, can you unmute yourself to ask your question? Does not appear to be working. I'll follow up with you afterwards. Sorry about that. Kristen Seamus.
Thanks for taking my question. Given the data laid out here today, especially with the risk of transmission in schools, why isn't MDHHS requiring masks now, mandating them like some other states have done?
I guess I don't know if we have an answer for that question right now from Dr. Line-Callow. Once again, that would not be in her purview to make that mandate. So once again, Kristen, I can get back to you afterwards.
Dr. Khaldun is on the line. She can.
Yes,
How about her?
Lynn, I can take that.
Oh, I'm sorry. I didn't know if you were going to unmute. I didn't know if we lost you. Thank you.
Yes, I thought Director Hertel might be on. So yes, we and I've said it before. I'm concerned about what is happening, what could potentially happen with our schools. We have put out and updated our guidance last week, and specifically recommended that schools implement a universal mask requirement so we can protect our students, keep them in-person learning. We continue to work very closely with our local health departments, providing information to our superintendents as well. We do understand that there currently is a law that would allow us to be able to implement that mandate, but at this time, the governor and the director have not made that determination.
Oh, did you recommend it to her, doctor?
Throughout this entire pandemic, it has been my job to always recommend public health interventions and policies that would be protective, and I've continued to do that throughout the past several weeks as well.
So you did recommend.
Thank you. We are going to move on to Andrew Feather.
So my question would also be to Dr. Caldoun there. To follow up on that, did you specifically recommend to the governor and to the director of MDHHS that implement a mask mandate in schools?
I have recommended that if a mask mandate were in place and it were followed, it would likely decrease the spread of COVID-19 in schools.
Okay. And we're going to wrap it up with our last question. Catherine Wells.
Yeah, sorry to be the 8 millionth question on this. Has the governor then, Dr. Caldoun, given you any explanation, or can you provide us with any explanation on why we're not doing that then? Again, it's I think we're all coming from a place where the data on this slides is so stunning. The risk to these kids seems so strong. What is there to lose at this point by having a mask mandate?
No, I cannot speak to that. I do know that my lane is to provide public health guidance, but I also recognize that there are many other things that have to be considered when it comes to implementing a mandate.
Can you give us an idea, though, of some of those considerations so we can present them to people?
I cannot at this time. I would defer to the director.
All right. Thank you all very much. I'm going to be sending the presentation out following this, probably in the next half hour, hopefully. We will have a recording posted to the web, and I will send you all a link to that as well. Like I said, feel free to send me an email at sutphinl1@michigan.gov on any questions that you may not have had a chance to get answered. Thank you all very much. Once again, Dr. Lyon-Callow, thank you for your presentation.